Hi everyone, I am Mohammed Wazim Akram. Today's topic will be discussing the association between erectile dysfunction and diabetes. Erectile dysfunction is a common complication of diabetes, but it is not spoken about widely. People find it be an uncomfortable conversation to have with their doctors, but let's change it. Let's talk about it. So, what is erectile dysfunction? Well, erectile dysfunction is defined by the inability to achieve or maintain an erection, which is sufficient for sexual intercourse. Erectile dysfunction is not only affect the quality of life of the person, but their partner and their relationship. As you age, there is a chance of developing erectile dysfunction. As you can see, the chances of erectile dysfunction goes high. A study done in 2022 in the United Kingdom found that 41.5% men reported erectile dysfunction. This increases when you are living with diabetes. The prevalence of erectile dysfunction is approximately 3 times higher in men with diabetes than in those without diabetes. How does diabetes affect erectile dysfunction? Diabetic neuropathy, a key microvascular complication. It is caused by ischemia, advanced glycation end product, and free radicals, which impair nerve conduction and cause demyelination, which is the damage to the myelin around the nerve. Many large studies link diabetic neuropathy to erectile dysfunction, and in here you can see the healthy nerve and demyelinated nerve here. Both peripheral and autonomic neuropathy contribute to erectile dysfunction. Peripheral neuropathy impairs sensory and motor impulses, weakening pelvic floor muscles, and increase venous outflow from the corpora cavernosa. Autonomic neuropathy decreases parasympathetic activity needed for smooth muscle relaxation in the corpora cavernosa. This condition also impairs nitric oxide production, essential for initiating and maintaining erections, thus compromising erectile function in diabetic neuropathy. And in here you can see this is flaccid penis and this is erectile penis. In here, this is the corpus cavernosa is these two, and in here the same, but in flaccid state it is not filled with the blood, but with the erect stage, it will pour up with the bloods. Now we are going to see about the impact of high blood pressure. High blood pressure can impact erectile function primarily due to penile arterial dysfunction. This includes arterial narrowing and smooth muscle tissue thickening. Here you can see the thickening, which decreases blood flow and cause endothelial damage, leading to reduced nitric oxide production. Next, hyperlipidemia. Hyperlipidemia affects 42% of men with erectile dysfunction. Dyslipidemia significantly increases atherogenic risk and contributes to erectile dysfunction. It is an independent risk factor for erectile dysfunction in diabetes patients. They have a 2.3-fold higher risk of dyslipidemia. High LDL, low HDL, and hypertriglyceridemia are linked to erectile dysfunction. And you can see here, it's a normal artery, and here it's narrowed because of the cholesterol plaques here, Due to the cholesterol plaque, the blood supply will be reduced. It's the same mechanism in happening in cardiovascular disease. Some studies confirm that direct link between erectile dysfunction and cardiovascular disease. Individuals with erectile dysfunction exhibits a higher incidence of cardiovascular disease and diabetes across all age groups, starting at age 30, peaking between 60 to 69 years and persistent throughout the life. Erectile dysfunction often appears 2 to 5 years before coronary artery disease, providing a crucial window for early detection of silent coronary artery disease and stroke, particularly in patients under 60. Another risk factor is obesity. Obesity is associated with 50% increase in erectile dysfunction. Patients with metabolically healthy obesity maintain better erectile function compared to those with metabolically complicated obesity. Next, we're going to see low testosterone levels. Studies indicate that up to 40% of men with type 2 diabetes have low testosterone, with over 90% experiencing erectile dysfunction. Low testosterone in diabetes patients is often linked to low gonadotrophin levels, suggesting functional secondary hypogonadism, influenced by insulin resistance and increased estradiol from visceral fat. Low sex hormone binding globulin levels are common in diabetes and correlate with higher HbA1c levels, indicating a higher risk of developing type 2 diabetes. The next is depression. 40% of patients with depression more likely to suffer erectile dysfunction. Depression affects sexual function through both emotional and cognitive process, leading to erectile dysfunction, reduced libido, and decreased intercourse frequency. Depression is twice as common in diabetes patients, and erectile dysfunction can exacerbate existing depression. Antidepressant can also worsen erectile dysfunction. A recent meta-analysis found that men with diabetes and depression symptoms are over 6 times more likely to experience erectile dysfunction than those without depressive symptoms. Next, some drug side effects cause erectile dysfunction, mostly antidepressant, especially SSRIs, and cimetidine, ketoconazole, spironolactone, sympathetic blockers, and thiazide diuretics and beta blockers. AC inhibitors and calcium channel blockers are safe and considered safe, and alpha blockers improve the erectile function. What are treatment options? Obviously, lifestyle changes, medical management. If it fails, go to the surgical management. Lifestyle modification and glycemic control. Changing your diet is the first step. Eating a healthy, well-balanced diet will promote healthy weight loss, which will not only help erectile dysfunction but also manage your diabetes, preventing long-term complications. Weight loss also increases the amount of testosterone in the system, which will help men with erectile dysfunction. And with the diet and regular exercise and stop smoking, reduce alcohol intake will help improve erectile function, and also for counseling for psychological uh, cases. When you need to go onto the medications, you will be prescribed one of the following. Uh, PDE5 inhibitors such as sildenafil, vardenafil, tadalafil, avanafil, or like finish with fil. And these drug working by elevating cyclic guanidine monophosphate levels in the cavernosal tissue, which is found within spongy tissues of penis, resulting in the muscle relaxation, increased blood flow, and ultimately an erection. The venous flow is also constricted so that erectile erection can be maintained. And also, other than that, there are urethral suppositories, topical creams, and injections. Now we are moving to surgical intervention. When lifestyle changes and medications don't improve erectile dysfunction, the final step would be surgical intervention. There are two surgical intervention. One is penile implant and one is penile revascularization surgery. In penile implant, there are two methods. One is malleable and other one is inflatable. The malleable implant has two blendable rods in the penis that you position for intercourse, and the inflatable implant has two cylindrical and pump in the scrotum that you use to fill the cylinders with fluid to create an erection. And the final one is penile revascularization surgery. This is this surgery is to connect the inferior epigastric artery to the dorsal artery or deep dorsal vein to improve blood flow to the penis and reducing blood outflow. In conclusion, erectile dysfunction is a treatable condition. If you are having erectile dysfunction, please talk to your doctor and get the treatment without any delay. Erectile dysfunction also independent risk factor for cardiovascular disease, so improve your cardiac health and avoid adverse cardiac events. Thank you.